Hey, what's going on, family? It's another day in the world. I hope you are doing blessed, doing well, sending a lot of positive energy to you. Now, today it's another mentorship call, and we are broadcasting all the way out to the UK, and we are speaking to a pharmacist. One, she's going to let us know how she got involved in pharmacy, what's her journey to being in this profession, I should say. And then how can we protect ourselves? She's in the medical industry and we're dealing with a medical crisis right now all around the world. So, I'm definitely going to kind of hit on that and see how we can get some jewels on how we can better protect ourselves. So welcome to the platform. Welcome to Mentorship Call. Aduke Afarube. Aduku Afarube.
Yeah, that's fine. Hi,
how you doing?
I'm okay, thank you. How are you?
I'm blessed. All is well. All is well.
Oh, that's good. Yeah.
Now, based on your introduction, you are a pharmacist. Can you tell us a little bit about how you became a pharmacist and what was your path to getting in this career?
All right. I studied pharmacy in Nigeria, University of Nigeria, Nsukka. And to get into the pharmacy school, I had to obviously go through my secondary school education. And I did my what we call GCE. And I had my credits for my science courses, chemistry, physics, biology, and as well English and maths. Then I also wrote JAMB. We have to write an exam before we can get into the university. So I passed my JAMB. Then I got into pharmacy school in UNN. And I began my pharmacy career, actually. So pharmacy in UNN was really interesting and a little bit of intense, a lot of hard work, a lot of reading, and and I went through all that. Then after that, I did my internship, because after graduating from pharmacy school, we have to go through a 1-year internship. So I did my internship with the Ministry of Health in the capital of Nigeria, which is in Abuja. And after my 1-year internship, I also had to do my 1-year youth service. So we have this youth service every graduate has to go through, and it's a 1-year period where you serve the government, and you could get posted to a public sector company or a private sector company where you get paid by the government, and you also get drilled in a military way for 3 weeks in a camp. So it's all exciting, and you just get groomed and prepared for adult life, basically. So I went through all that, and I practiced pharmacy in Nigeria for some years, and I relocated to the UK and continued to practice pharmacy.
Awesome. So tell me this. I like to compare cultures. Growing up in Nigeria, growing up in Nigeria as a young woman, what were you told about your career? How do you find your career? Like, do your parents pick it for you? Is your family all in medicine, or did you just say, "Hey, I'm gonna be a pharmacist no matter what"? Like, how does that come about in Nigeria?
Well, my parents, I had educated parents up to master's level. So I've always been a science student. So although I tried to combine science and arts when I was in secondary school, but I picked my course myself because I was just interested in healthcare. And so my parents just allowed me to choose a course for myself, and they also allowed all my siblings to choose their courses. So I know that there is this thing about Nigeria and maybe India where people say their parents choose their courses for them. Well, it's not always the case for everybody. I filled in my JAM form myself, and I put in a course of my choice. My first choice was pharmacy. I think my second choice was civil engineering or something. I don't know, but my first choice was pharmacy, and I didn't want to study medicine. So I just had to, if I had to be in the healthcare sector, it had to be a professional course. And I loved the prospects and the idea of being a pharmacist. So I chose pharmacy. Yeah.
Awesome. Thank you. Good answer.
Yeah.
Tell me, inside of the world of being a pharmacist, specifically for you, are you working inside of a hospital? Are you working inside of community pharmacy? How does your life look like?
Well, I've worked in hospital, in community. I've actually worked in different sectors as a pharmacist, but right now I'm working in a clinical commissioning group. So what we do is to commission services on behalf of the health, on behalf of the government, on behalf of the health sector. So we commission services for a particular area, and we do medicines management, and we ensure that all the care provided is within the budget. So that's one of the things that I do at the moment. Then I do a whole lot of things at the same time. I also volunteer for the UN SDG advocacy, and I advocate for SDG 3. So I'm an SDG 3 advocate, and I advocate for good health and well-being. So I do a lot of things around that. I do a lot of public health campaigns. I do a lot of health promotion. I write a lot of articles. And recently, I have been an on-air health expert as well. So I do get calls where I feature in TV shows, health shows, and I contribute to health discussions like during the COVID pandemic. So I do a lot of things actually. I can't if I start talking about what I do, I wouldn't really end this talk. So, but basically, I practice pharmacy, and I am also an independent prescriber. So I do prescribe, do consultations. It's a whole lot of different things that I do. Yeah.
Got it. Busy woman. I love it.
Very busy.
Yeah.
Yeah.
But I can tell like this is what you love. So it's not really work, it's your passion. So that's amazing.
My passion, yeah.
Absolutely. So tell me this, because we are in Corona, COVID, pandemic, lockdown, quarantine, phase 1 through 4. There might be another one coming back, Corona 21.
Oh God.
So we're gonna go down this lane. What is this time like for you right now as a person in the medical? How are you doing?
Well, I had to go through. I've gone through different phases. There was the first phase when I was just about to finish like a little annual leave that I took, and I was just about to start work, and this lockdown thing started. So I went to work. I was confused. I didn't know what to do, but I reported to work that day, and I was asked to go home. So I became confused. I was like, how am I going to, do my patient consultations? How am I going to do all these things? And what's going to happen? I was just told to go home and wait. So it took some time. We had our IT equipment delivered to us. I had to go and collect my IT equipment. I had to get my VPN because I need to log in securely if I'm going to be dealing with patients at home and doing consultations and others. So I had the secure login and everything was set up. It took some weeks to get those things sorted. So there was so much confusion in the air and we didn't know what to do. We were a bit scared. Then I received a letter from my from my family doctor telling me not to go outdoors for 12 weeks. So I was like, I don't know what was going on. Then I had to, there was this policy that came out from the government that if you're taking certain medicines or if you fall under a certain category or maybe you have a kind of medical history, you have to stay indoors for 12 weeks. So when I received that letter, it said I shouldn't open my window. So I was like, so I called
when you said that, I'm running through my mind like maybe I misheard her.
I was like a prisoner. I was in prison in my own house. So I called my boss. I was like, oh, I'm not a prisoner. I'm asked not to open the window. So it was it wasn't funny. Then after that phase, and we went through all that phase, then started working from home, then got used to working from home. It wasn't very easy. And so I started working from home and things were a little bit more clearer and we started doing like preventive measures. So I took the bull by the horn. I was advocating for preventive measures all over the place. I was doing social media videos in different languages. I was writing articles. I was featuring, coming out to talk about COVID-19 prevention, treating patients in Nigeria. And I was also informing the general public because there was so much information overload. I had my relatives calling me, asking me, should I take this? Should I take ginger? Should I do this one? So I was actually worried because I had to do like medicines review for everyone. I had to tell them what to take and what not to take because certain herbs can interact with the medicines they are taking. So it was like a whole lot of, so So I had to do a lot of public health campaign. That initial period around March, April, when it was really getting very, very hot. Then preventive measures and all that. So we're just getting by and getting used to the new normal. It hasn't been easy for anybody, and it hasn't been easy for healthcare workers as well. I would say I'm a little bit lucky. I could work from home, but some of my colleagues had to go into the hospitals and all that. But I just thank God for everything. It has been a difficult period for everybody, but people are coping, and some people have sadly lost their loved ones as well. So I also try to encourage people. There was an article I wrote about coping with grief. So it has just been, very busy last few months, and we're just, we're just trying to cope and just keep living and keep believing that everything will be fine.
For sure. So my mother is a nurse, and so and we're in New York City. So in the epicenter in New York, and my mother was pregnant with me during the AIDS epidemic. And so I remember her telling me stories. I was pregnant with Monica when this happened. So I'm like, you don't need to go through this again. So I'm starting to tell my mom, like, to retire. You don't need to be on the front line because that's what it is. We didn't sign for my mother to be on the front line of the Iraq war. And so that's what it really felt, and that's what it was. And for the first time in my life, I asked my mom, like, how's your mental health? And she was like, it's terrible. Like, it's terrible. And so I was really just like, I could lose my mother. I could, this is serious, and she's losing her in the hospital. And they didn't know what to do at first. They were really underprepared, didn't have the equipment, didn't know when to wear the mask, when not to wear the mask. So it was a really, really scary time. So and just really helping her focus on her own mental health. Like, it's okay to cry. It's okay to breathe, meditate, yoga, eat good, take care of your life. It's okay to leave. And so, we dealt with a lot here. And at 7 p.m. every day in New York City, everybody stopped and claps for healthcare workers. So thank you for the work you do.
Thank you so much.
Because y'all on the front lines, and really without you, more lives would have been lost. So,
we all need help anyway. It was a very scary period for everyone. We lost some, frontline healthcare workers, even here in the UK. I know in the US and Nigeria and all over the world. And I also I wrote a lot of articles and I did some videos around mental health, because it was, this period has been so difficult and people had to take their mind off the whole thing to survive. So I encourage a lot of people to exercise, try and engage in healthy eating, even exercise indoors. Even before, there was a time they didn't allow people to go out to the parks to exercise. So I shared a lot of exercise tips, how you can exercise indoors and have some physical activity, which could also help to elevate the mood as well.
I bought a row machine off of Amazon, so I can work out at home and stay healthy. Man, so once again, just thank you for being on the front line. Now, what are you seeing as time has evolved? Because now we're like, 5 months in, going on 6 months in August. What does the other side look like? Or are we really going to deal with a second phase of this? That's what I'm hearing. The whispers of there's another one that's going to hit.
I think the line is breaking a little bit. What was the question? I didn't get the question. If you want to write it or something. So
there's whisper of a second wave of corona coming. Are you here?
Well, I've heard about something like a second wave coming, but that is just it's like trying to be prepared. Nobody knows. So I can only say, but we are also tightening up some rules at the moment, because in the UK now you can't go into any shop without your face mask. It wasn't like that before. So I believe if we try as much as possible to wear our face masks and try and avoid crowded places and things like that, which I know it's very difficult to do. And if we can get the vaccine, and if we can try and implement every preventive measure where possible, I think we might be able to prevent the second wave. But honestly, if the second wave is going to come, I don't know how we're going to cope with that. But for now, I just want to be positive that we wouldn't have a second wave. And I think we should concentrate on preventive measures, and also be patient about scientists developing the vaccine and other things. So let's just hope that everything works out well, actually.
Yes, that's a great thought to have. So let's talk about preventive measures. Because at least I know here in America, America is so big that you have states where people are saying, I'm not wearing that, I'm not doing this.
Yeah.
You can't tell what to do. It's because they've seen what happened in New York and think it's not going to happen to them. But now we're seeing in the South, the rates have up because of people's inability to want to participate wearing a mask.
Yeah.
What do you advise as the preventive measures to keeping corona down, keep people getting sick? What do you say?
Yeah. Well, I think the first thing is, don't go out unless you definitely have to go out. Well, that is the thing. Like me, I only go out to do my grocery shopping, and sometimes I do like moderate exercise, like walking around the park. So I don't go for any parties. I don't go to church. We have been having our online service, and it's just basic common sense. But I know that some people might not be able to do it the way I'm doing it. So everybody is different. Some people have to go out there to run a business. They have to go out there to do something to earn a living. But the hand sanitizers, the hand gels are highly important. If we can always ensure that we go out with our hand sanitizers, and also wear the face mask. So these two things, and just basic respiratory hygiene. If you're trying to sneeze, or don't sneeze on your palm, or always wash your hands with soap and water. So those things can help. And we just we just have to try and, as much as possible, to stay away from crowded places. Don't go to that party. I mean, let's just try as much as possible to hang in there till this thing, till this period, this pandemic just, disappears, if it can, because we can't really do much, but we can just do the little bit that we can just to help the situation. Yeah.
Right. How do you feel about the vaccine? Because on the civilian side, we are afraid of anything is population reduction. Bill Gates.
Yeah.
How do you feel about it?
Well, as a scientist, I understand the use of vaccines, and I understand the importance of an antiviral vaccine for this coronavirus. And I don't really know why we have conspiracy theories coming up around this vaccine thing. I don't just see, because we have a lot of people in Nigeria as well peddling this conspiracy theory thing, and I try as much as possible to offer evidence-based scientific information. But I think we should just be open-minded, and we have a virus, and if it's going to be vaccine that we need to make this pandemic go away, then we just have to do that, because we don't have any other option apart from the preventive measures, the vaccine, and some of the medicines that have been going, we've been using for clinical trials, using them on very ill patients. So those medicines, the vaccines, and the preventive measures, those are just the three things that we can do apart from praying and having hope. So I mean, but I don't think anybody is going to, I don't know how, if a vaccine comes out, if it's going to be compulsory. Well, I don't really know. But for those that don't want vaccines, for reasons best known to them, they shouldn't be peddling lies or preventing people that need to be vaccinated to be vaccinated. So that is just what I have to say about it.
Yeah. What about eating good, exercising, reducing your stress, building up your immune system? What kind of advice do you give on that?
Well, it's highly essential, even at this time, that we engage in exercise and healthy eating, because these things can help to boost our immunity. And at this time, when Black people as well, they have a tendency to have low vitamin D levels in their blood. So this is a time for people to start taking their vitamins, even if you didn't used to take it before. These days, I take my vitamin C, my vitamin D, and I take my lemon tea. So anything that can help, then just cut down on saturated fats and processed sugars, and eating more of fruits and vegetables, and engaging in indoor exercise or moderate exercise, like having walks, anything you can do like jogging. These things are just very important at this time that we engage in them, because it can help to make us elevate our mood. It can help to make us feel stronger, and also it's a good immune booster as well. Yeah.
Let me ask you this, kind of going off in the same vein. How can media, the media world, how can media help to encourage people to live healthier lifestyles?
Right. Well, it's just, well, I know the kind of adverts we get all the time. I know some countries are trying to ban certain adverts, from, I think, from 7 p.m. or 6 p.m. I don't know. We have a lot of adverts that promotes junk food and things like that. So if the media engages in showing more adverts about fruits and veg, I know, trying to, reduce those adverts that show a lot of sugary drinks and fizzy drinks and things like that. I know that people have a business to run, but the government also has a role to play in regulating all those things, because at the end of the day, if we have more obesity and overweight people, it's going to increase the risk of cardiovascular disease, cancer, diabetes, and things like that. So the media has a role to play in helping out in this situation, and the government has to regulate what the media shows to the people. Yeah.
Yes, I agree. I definitely feel like America got hit so hard because we were so unhealthy.
Yeah.
Just what we eat, what we consume, how we think. We were already arguing with each other over Trump.
I don't get involved in American politics.
Listen, don't. We try not to. It's just
I don't get involved in American politics.
Don't start. You don't win, no matter what side you stand on. You still don't win.
Yeah.
but there's definitely just a lot of just unhealthy. I feel like the last few years has been really unhealthy living.
Yeah, I know.
So Corona was just like, Corona could have been a regular flu for us, but we just took it over, And so I definitely feel like, what you said is so important to boost our immunities, but globally, because we're stepping into the age of Aquarius. It's, it's a new decade. We need to take better care of ourselves for sure.
Of course. Yeah, of course. Yeah.
Awesome. So I know you got to go, but I'm so grateful to have you on the platform. You gave some amazing tips. And if anybody would like to reach out to you, because I know you're doing a lot, how do people contact you?
Yeah. Well, the best way to contact me is to send me a message on my page, Ask a Pharmacist with Adaku. So I have a poster. It's got my phone number as well and my email address. So if you go to my Facebook page, Ask a Pharmacist with Adaku.
Can you put that in the private chat? I'll pull it up as a banner.
All right, that's fine.
Yeah.
So yeah, I'm just gonna type it on there
so people can see it.
Yeah.
Ask a Pharmacist Adaku.
Ask a Pharmacist with Adaku. That's the Facebook page. Then I have a program that I run every Friday between 10 a.m. and 4 p.m. It's called Ask Me Anything. So I do medicines information, medication reviews, and I coach people on lifestyle management and things like that.
That's great.
Yeah. So the poster is in my Facebook page. So yeah, if they go there, they'll see everything. Yeah, even the phone number as well. Yeah.
And that's on your Facebook as well. Ask Me Anything.
Well, the Ask Me Anything poster is on the Ask Your Pharmacist Facebook page, and it's it tells you in details the kind of things that, well, I could be. You could ask me things about medicines information. I do medication reviews, and I coach people on lifestyle management. So,
got it. Do you ever get any like weird questions? That's like, I'm not gonna answer that.
Well, if any question I cannot answer, I try to signpost. Yeah, I don't push people away, because I'm like a coach. So I take questions, all sorts of questions. So anyone that I cannot answer, I can signpost. I have other healthcare professionals that I work with, and I have people in different fields and different areas that can help as well. So I do signposts.
Got it. Got it. Awesome.
Yeah.
Awesome. Well, thank you so much, sister. Good. Keep up the good work. Thank you so much for what you're doing
All right.
for humanity.
Yeah.
I appreciate you. And however, if you need a media platform to help with whatever you're doing, please let me know.
All right. Thank you, Monica. Thank you very much for having me
Thank
today.
you very much.
All right.
Absolutely.
Take
Bye-bye.
care. Bye.
Well, I hope you learned a lot. Take care of yourself. Take care of your immunity. Put those chips down. Stop eating that sugar-filled donut. Throw away that Coca-Cola. Whatever you're consuming, if it's not good for you, don't do it. Go out and get some sun. Breathe air. But don't breathe around other people unless you got a mask on. So go into the woods and breathe some good air and take care of yourself. Take care of your life. That is another mentorship call. I thank you so much for tuning in, and I hope you learned something. If you'd like to reach out to the sister, like she said, ask your pharmacist Adaku. She's on Facebook. She does her own media, so you can ask her any questions you like. And before I close out, just know that we are still in pre-order of Mind Your Business and Prosper, a young entrepreneur's guide to being successful. You can go to Young Boss Media right now and order your copy. It'll be a signed copy. The official global release is on August 17th. Now that's my time. Thank you so much. I'll see you soon. Peace.